This is Dr. Derek Mahony from Sydney, Australia. I'm just about to have a dinner party with some of my close referring dentists, and what we're going to discuss is the benefits of early interceptive orthodontic treatment. And I'm very pleased to say working within our organisation now is Dr. Elina Castro, and Dr. Elina is the doctor that I refer all my patients to if they need lip or tongue tie release, because she's very good at that. She's good at dealing with nervous children. She's been trained personally by Dr. Zaghi, who is one of my favorites around the world. He's a very well-qualified ear, nose and throat doctor, and he uses a very good technique that allows proper release of lip and tongue ties without scar tissue, etc., etc. The other thing that Elina does for my young patients is what's called planus build-ups. So if I have a child in primary dentition who has a postural shift of the mandible or a functional crossbite, Elina builds it up with composite on deciduous teeth. It helps a lot with patients who have recurrent otitis media, and she's been trained in this technique by Professor Ramirez, and Ramirez was trained under Pedro Planas, the guy who developed it. So it's really good that Dr. Elina is trained by the best, by Dr. Zaghi for the lip and tongue ties, by Dr. Ramirez for the planus, and she's done Buteyko breathing courses, mainly through Patrick McEwen. And so, you know, I can take a young child who is a mouth breather, who has a lip or tongue tie, who has a crossbite, and I can send them to Elina, and she sorts all these problems out for me, plus she understands the whole philosophy of early treatment and facial growth. She's very big on early treatment appliances. So after she's sorted lip and tongue tie problems, once she's got the planus working and the kid's breathing through the nose, she then supplements that with some form of myofunctional appliance. And you know, the kids come back to me as different children. I mean, it's almost like for a general dentist, you put fluoride in the water, you can almost reduce the incidence of caries and cavities. To me as an orthodontist, I see a young kid, obviously with a poor swallowing pattern, obviously a mouth breather. You know, Elina gets in during the important time when the jaw is growing rapidly. And so when they come back to me at 7 for a review, many times I don't need to use my expanders. Many times I don't need to do my degainers. So I'm very happy to work with Dr. Elina. I hope you'll come and meet her when she does lectures with EODO. And she is in 4 locations around Sydney. Please refer your patients, the young ones, to her, because she's very good at that. I've never had one complaint from any parent, any patient in the 5 years that I've been referring her patients. So I'm very, very pleased to introduce Dr. Elina Castro, fill my name Blair's, and she will look after your young children as well as she looks after mine. Elina has one philosophy. She has a young daughter herself, and she says, I treat all my patients, Derek, as though they're my own children. And that's so true, so true. So please send your young patients to Elina. She'll look after them for you. This is Derek Mahony signing off.